Thank you to the CyberMed team for the opportunity to speak today, and I'll be speaking on healthcare and the National Cybersecurity Strategy. So as mentioned before, my name is Dr. Jacqueline Burgette. I am a White House Fellow with the Office of the National Cyber Director in the Executive Office of the President. I am a clinician, and I've served in large hospital systems and rural health clinics. I'm an expert in health services, where I identify programs and policies that reduce healthcare costs, improve the quality of care, and maximize health outcomes. And I'm a policymaker, and I seek cross-cutting solutions for health and cybersecurity. So I believe that technology and the technology that we use can enable us to deliver high-quality care and improve access to health services so that we can deliver the best care for all Americans. Healthcare and patient safety mean cybersecurity, and that matters to me and my patients. So as the speakers today have discussed, healthcare is a rapidly growing sector that is vulnerable to cyber incidents. It is made up of both public and private sector organizations related to patient services, medical devices and manufacturers, electronic health records and medical records, all of which require timely access to considerable amounts of personal information and unchangeable medical histories that make them frequent targets of attack. I would like to double underscore our previous remarks today about the vulnerabilities of the healthcare system to ransomware and data exploitation. Government, including the Executive Office of the President, is an active agent for change, and change is needed to protect the healthcare and public health system, which is part of our critical infrastructure and vulnerable to cyber attacks from foreign adversaries and cyber criminals. On an individual level, these attacks not only compromise personal information, but can affect patient safety and health. On a systems level, these attacks can close down hospitals and clinics across communities, states, and regions. And on a national level, these attacks can compromise our economic prosperity and national security. On March 2nd, the President released the administration's National Cybersecurity Strategy. The Office of the National Cyber Director led the interagency effort to draft the strategy, and we are grateful for the contributions and inputs from our interagency partners in the private sector during our engagements and discussions, including healthcare, over the past year. The National Cybersecurity Strategy nests under the National Security Strategy and builds on the President's work from the last 2 years, including the Executive Order improving the nation's cybersecurity and the National Security Memorandum 5, improving cybersecurity for critical infrastructure control systems, among many efforts and initiatives. In this strategy, you'll see a balance between building on areas of success, especially around operational collaboration and information sharing, and then taking bold steps forward in new areas. The goal of the strategy is to develop a digital ecosystem that is defensible, resilient, and aligned with our values. By defensible, we mean it's easier to defend than it is to attack, and by resilient, we mean that when cyber incidents occur, the effects are not catastrophic, and we can recover quickly. So the 2023 National Cybersecurity Strategy calls for 2 fundamental shifts in how the United States allocates roles, responsibilities, and resources for defending cyberspace. First, we need to rebalance the responsibility for defending cyberspace. Today's digital ecosystem too often devolves risk downward onto individuals, small businesses like clinics, and local governments, asking those with the least capability or resources to be our first and last lines of defense against the world's most malicious cyber actors. Security and resilience in cyberspace should not rest on a single person's constant vigilance. The defense of "don't click that" for healthcare workers and patients is not a sustainable cyber defense model. The biggest, most capable, and best positioned actors, whether they be in the public or private sector, can and should assume greater risk and the burden of mitigating risk for all of us. Cyberspace's most capable actors, including the federal governments, in unprecedented collaboration with the public and private sectors, need to re-architect our digital ecosystem so that responsibility for its security and resilience is more deeply woven into the technical and policy foundations. The second fundamental shift is that we need to realign incentives so that governments, businesses, and others can invest in long-term solutions rather than short-term reactions to the immediate threats and risks of today. Ultimately, there's a balance between defending the systems we have now and investing in a resilient future tomorrow. So the strategy advances these two fundamental shifts across 5 pillars. The first is we need to defend critical infrastructure. We need to give every American confidence that in the availability and resilience of our critical infrastructure and the essential services it provides. Second, we need to disrupt and dismantle threat actors. We will use all instruments of national power to make malicious cyber actors incapable of threatening the national security or public safety of the United States. Third, we need to shape market forces to drive security and resilience. We will ensure that market forces place responsibility on those within our digital ecosystem that are best positioned to reduce risk and shift the consequences of poor cybersecurity away from the most vulnerable, making our digital ecosystem more trustworthy. Fourth, we will invest in a resilient future. Through strategic investments and coordinated collaborative action, we will continue to lead the world in developing secure and resilient next-generation technologies and innovation. And then finally, we will forge international partnerships to pursue our shared goals. We will promote a global cyberspace where responsible state behavior is expected and rewarded, and irresponsible behavior is isolating and costly. Ransomware to hospitals, for example, is a transnational threat. So I'm going to spend the rest of my time discussing healthcare in the context of the first pillar of the National Cybersecurity Strategy, which is to defend critical infrastructure. As we can all agree, the healthcare and public health sector is a very important part of the United States critical infrastructure. And for all of our areas of critical infrastructure, we have 3 areas of focus. First, enhance collaboration. 2, cybersecurity regulations. And 3, the federal government improving its coordination and cybersecurity posture. So for enhancing collaboration, we're talking about true operational collaboration, which is not just information sharing. Our goal is for public and private sector experts to be sitting side by side for exercises, planning, disruption, and defensive operations. The Office of the National Cyber Director has hosted a series of executive roundtables to promote critical cybersecurity discussions in collaboration with leaders of sector-specific companies. For example, we had a sector-specific meeting with energy company CEOs with Secretary of Energy, Jennifer Granholm, as well as healthcare CEOs and the Deputy Secretary of HHS, Andrea Baum. The healthcare and public health sector has made progress with the release of several products as a result of collaborations this past March and April. And the collaboration between the Healthcare Sector Coordinating Council, the Health Information Sharing and Analysis Center, 405D, the Sector Risk Management Agency, National Security Council, Office of National Cyber Director, and CISA are a start, but we have so much more work to do. Second, the strategy calls for examining the need for cybersecurity regulation. We recognize that public-private partnerships and collaboration are essential, but a voluntary-only regime is inadequate to meet the evolving cyber threat landscape. Despite all the progress we've made through voluntary approaches and operational collaboration, our critical infrastructure is not sufficiently resilient to ensure our national security and public safety. We've seen this play out with disruptions like Colonial Pipeline and the Common Spirit Hospital Group. We see regulation and collaboration as complementing one another. Properly developed regulations, as well as the oversight, supervision, and reporting on the back ends, can incentivize better cooperation and collaboration and strengthen relationships. Regulation is just one tool. It's not the right option in every case. And over the long run, we need to also shape market forces to produce better cybersecurity outcomes. But when national security and public safety are at stake, we have to make sure that we're achieving certain minimum cybersecurity outcomes. And today's cyber threat environment has outpaced the ability of market forces.
It's Thursday, April 20th. I'm Shamika Basu. This is Apple News Today. On today's show, how an unusual Senate fight is having an impact on the federal courts. A look at how and why the House market is so strained right now for renters and buyers alike.
Don't feel bad.
Netflix shuts down part of its business.
Regulation sometimes has this effect on people. When national security and public safety are at stake, we have to make sure that we're achieving minimum cybersecurity outcomes. And today's cyber threat environment has outpaced the ability of market forces and voluntary measures alone to meet that threat. So when cyber regulations are developed, we have to do it the right way. That means cyber regulation should be outcome-oriented, performance-based, risk-informed, developed in consultation with stakeholders, and harmonized. We need to align our existing standards to keep the burden of compliance down and focus investments on resilience. And finally, cyber regulations need to be designed with the economic context of the healthcare and public health sector in mind. Policies and programs must avoid placing an inequitable burden on hospitals and clinics serving diverse populations. Our discussions with stakeholders in the healthcare sector seek to amplify voices of small and rural hospitals as well as healthcare entities serving low resource and diverse communities so that we develop solutions that help all Americans. Third, we're asking for more from the healthcare and public health sector, and we recognize that government needs to step up here too. We have our own role to play. What that looks like is the United States government doing a better job making sure our incident response policies and plans are clear, so that hospitals and clinics know who to call when they have a potential cybersecurity incident. You shouldn't have to reach out to 5 different entities to report an incident to try to get help. Our goal is that a call to one is a call to all. And finally, we have a lot of work to do to make sure that our own defense operations are more coordinated and ultimately more effective, that across government and with the public health and healthcare sector, we are doing a better job. So we are working with interagency partners to develop and publish an implementation plan to set up federal lines of effort necessary to implement this national cybersecurity strategy. We strongly believe in the collaborative approach, and we will continue to engage with the healthcare and public health sector stakeholders, whether directly or through our interagency partners, throughout the implementation of the strategy as we move forward. So thank you to CyberMed for having me speak. I'm happy to take questions afterwards off the record about the National Cybersecurity Strategy.